Mahmoud Bawumia apa hon entomano. DNA womuma ya pomodin the health aspect of the 2024 manifesto. Dr. Anthony Nsia Asare Eboakwaba.
Ya eja miracle.
Doc, bibi aboko dia.
Nyame adawro man ne mpa bo bibi aboko.
Ya da masen so ene edwumaden amaye achichire manifesto kama sei ama yinti nei ye bedidi nkomo kakra. Na ansa ne yebeba manifesto no so ankasa kra no. Ye pese obobo ne tofa kakra no twamfoni kakra maye. Ya yaresani ya pomuden nsem na ankasa no. Etesan asat 2016 na ene no Dana Dranko Kufa Dr. Mahmoud Bawumia empempen so be na yetumi atama ba bedru ansa kra obe chen Dr. Mahmoud Bawumia ni so ade ho wo man
yo mechia omo ayehwe ne omo mutie nyina we ama me kan bibi se ohwe sa Waow Mahama manifesto on say the key words you should reset ne kire se o me fa dibi no asa akọ akire no ahwede ewo mu asa na watimi akọ nanim ena yenia Waow Dr. Mahmoud Bawumia His Excellency so dia no ye upgrade so tie oba pajem
yeah
eti 2016 ye baaye no na ya pomodene na eninanim ye ti die ma ye hu ye kura se ya pomodene no eda na ye di ye obeka ya yeduru covid period ena ye hu se Ghana na efi se ye wo hospitals p if you say you mpa if you say you hospital for adwuma for ni ade gina you health workers a ma be ni ade gina even though country be anya problem but Ghana any other African countries now you see ya hwe ya kanye omo di animu a moye enkofo a onim di a o ma fa se de be sibia no ye be ye ama Ghana for afọ mo papa ifra obeka ya Waow president COVID by Oka Nema Mienu. Oka first and they say, I know how to bring the economy back, but I don't know how to bring a human being back. Second year Oka and they say, let us use what is happening at the crisis and turn the crisis into opportunities.
Yeah.
This is Nema Mienu. And now, Yebe 2024 COVID netwe mono. Obi a way manifesto bi anaso watching and so idea obeye no. And fear day anymore, and also the basis, and also exactly in Waow Bawumia at the year Juma. Tiabai and also infant mortality as I'm calling and make quite a wasu woo, Nipa Omunya even a 3 day idea obu say malaria kum colania dinano. The main chadie if free 2017 and buy no. We say one ta anti sem colepi woo malaria and conform a court. Ekoje ayaresa a omo efa efuro nyina akosoro nipa dodo a efre bibi omonya expert and I said midwives and I said doctor for hwe omo awo mo no so kosoro antenatal clinic enso kosoro de na ewo form kakra ye OPD attendance aba form kakra but no covid period na affected baby a obi a OPD attendance ba form nyamencha de wo hwe health insurance a ene ne timan ko for ko Koja yaresa bra onko ton ho ne manyina no 2016 na ni padodo a wo health insurance say about 10.5 million ye kasa CCR no apage mu edro about 17.5 million
the nipa be 6.5 million
6.5 abeka ho ni nyina ye first no beka ya obi pese onya health insurance otim koda the state office ho
yeah that's true
to because beda ho a ese afidie na say ba ne Waow Bawumia adawromenti no utimi tena wo fie na ada wo mpaso no waye star 929 hash na wasa yusu ye ne de ese utimi edi mobo koma obia
na ma se wo de app no kra ya kra utimi nya wo digital ID card a wo phone boss
ne de amount ti se obia nsoro nkosa line bi
yeah
eti wo hwe sa ne ma nyina no a ene ya sande abefo ne ma aba ti se digitization abba apomudene mo a emma okọ hospital afina ko delay mu ko twetwere wudin ne o card ko so card kora ayira you see ye digitization ye digital system health our hospital ye ku enim tin ye kase ye be upgrade ne ma ya ye no it take bold decisions ti obi betimi atena nkwanta na se pasa na obi wo whole teaching hospital no wo kire say oh operation we obetimi aye no ho fa no to table so your friend telemedicine no we hear digital health na our team the abefo ni abehye a je say obi anya ayaresapa ye ka say by 2030 no say obi enya quality
e-health and telemedicine so remember no
telemedicine je say a general is say the use digitization ama opese wo fie kura obetuma fa mobile phone na wabu kache doctor bi say doctor bi wo bi a call system bi wo ene me sorry me nisu brain kakra me wo hypertension e manema na wa kire odi also ye
enti me to ase ye a obite oti region pasa wa call the health facility ebia ne yare no the doctor na fi say ade we de ano eden kakra nti nka enka no nka be ka say ye be refer no if you pasa hospital na be na ba ho general hospital and a regional hospital but esa ne telemedicine nti doctor no work pasa no one doctor bia specialist bi wo ho regional hospital bedin komo let is the one here say do beto ambulance ma ba ho na ya hwe wo ho that's the telemedicine
and no opese o ko na chiri kura itimi unya gadgets ni si ebia pasa hospital na wo won so obi won bia na consult room and say na office ti otimi hwe patient no e direct kura ma otimi yo fasha
away
enti eno na ye pese e develop asa na obi develop ko ani mo no o se o digitize
system no
your system
e-health no
and e-health
it's a telemedicine is part of the e-health system na e-health no so na me say yes back so o say nei enka no say o yare na hospital na bia like clinic na ya show bibia o card no ho but what to kwan abankan na yare bebo wo kọ Madina Pentecost Hospital ye ni wo record bia ho
yes
enti ye tumi hu pose bia last week no ye show walate na ye ma we dro say how is the e-health fixing this gap
eno na ye pese o say ye electronic medical record system to nya electronic medical record system just be bia e computerized into your computer so enti no ane say e bia do free late health center na do ba e bia dodowa say kododowa na say ko tetekwashi ehia say kukuru wo fast nyina ko fa bra na ehwe ko fa wo series nyina bra me ehwe da bi eno ane say doctor no a wo late no e ma doctor no a owo tetekwashi hospital no say wa man no say this patient these are the pictures ti enam electronic system no obo ni nyina
copy baby na okra Ghana card na yare abowa based on your card and crampon they be retrieve
based on your record based on your card records, because if it is linked to your Ghana health system card system say because you accident in your first amba maybe we are allergic to BB and I say because our blood group you everything they share system to be here say ma moja in so we o positive na say twen ya
nti no ahya ase
eno nyina ahya ase but the basic no ye meyenya electronic health
which has
started in a lot. In fact, all the teaching was
into the upgrade, and they work manifesto. It is a neobi catch or say resetter. You have a choice.
Yes.
Based on their doctor in Siasa Rekano. Reset they be fa yes yako cash and carry. Reset they be fa yes yako card hospital card and
yes.
Reset they be fa yako doctor tro referral amount say yemfa wunfi pasa oti region and from 37. Upgrade here Dr. Mahmoud Bawo me ka ho asem ne say ya chance ye e-health ye expand no na wo doctor no work pasa no into many doctor what te kwa e friend say 37 na ko lebundi nkomo no hwe wo pasa wa na hu hia say obetu kwan aba
che di mo dimpa hu say
yes
fabra ne ehwe
ana say upgrade ne say nei no wa be piem e wo tamale enso na bia wo te ya samankese ba ye bo Ghana card share system no mu a you better be pulling with basic information no na you bisa wo doctor na once a man can say
push you
and now my authorization you get access to the way na mboa na yenhwe no
thank you
be all allergies bi e be drobi na yesa wonfa and e drobi na offer the last week say obefa bi mu a ni nyina be wo system na dey hwe so the choice between upgrade and reset when it comes to health sector is quite clear.
You
are resetting to the days of cash and carry.
Yes.
You are resetting to the days of waiting for weeks as an Osaka health insurance card. You are resetting to the days of renewal weeks. And as a will be protected upgrade, now upgrade ya kuenim. Where now, what's the doctor him now yet renewal of your Ghana card? Or for phone, who use to app now will register with the Ghana card. with doctor one cry aiding komo. That is the upgrade. So I think the choice is quite clear.
And the resetting crowd because say all the health infrastructure in and after na obetenase or 4 years. Obi you should be 2-3 years or him. So be resetting. No wa hwe asa na obeduru ho no.
Na time cross.
Time continue.
Ono so crowd don
agenda wa wo kuru mu a ebi a enuru ba bi a ebi ebetime awie no.
Afi no so be resetting.
Afi no be resetting.
Obe ye ni nyina awie no na
we ye no.
Obeka so be to so that the time aso.
It reset no. Also Ghana for nyina bi ma ehunu say we are up to something.
Yeah.
Into we reset here what year
echi. Anya hwe krampo no. You should upgrade because upgrade no takes care of fixing their SSA enko years see fix no. That's how the improvement abebemu. And we are far better. That one I think there's no doubt about that. Okay, Dr. Patrick into us.
Yeah, no the first year me setting up. Who say ayi buy no COVID buy 2019 COVID-19 buy a year first one. And that you pa say ye to sin e wo name pii mu. For example, say what who say first to one some years ago. They fa okwabrane oba wonyem a okope okwa wo a emoji etu no insuo ato enye ye kwa ne ho nyina o Ghana nyina na ye wo asphalt wo so enye bridges o Ghana nyina na bia ye wi eguso a ye ko ye timi de eba newspaper simo ne TV ne bibia so ne radio so ekukuru oba na ote oda pranka mu ana se oti moto so na kofo nan so moto no ye de nitwa isi ibi ne hobiem moja na ohia no yewura ba omi adaworo ma ne yewura kufu ado nimdia omunya ye ne ade bo hu se isi no bo hu se drones no ibo ha
zipline
yeah. Itimi edi drone no moja no ko ekoma ni pakoro baabi eno isi ye wo 6 distribution centers ye ne the largest drones distribution center in the whole world.
So they so the kuni papa o.
Yes. Yedi mi pese ohwe manifesto no e be ka ho asem. Yedi mi enu be ka ho na cover almost all the regions.
Yes, abaju de sum 2 am kra.
Wo woka wa ohia wo wadru a e say ni ba bia yedi wo wadru no kogu. Yedi most of them akogu drones distribution centers. Itinye se bia yedi be gu nkran kolebu a wo wonka wo bia for about 1 year. Na obiti e bia lambusi a wo ye fu ho a wo eka no anane duro ho na asa. But we know what distribution center ho a car ni pakro no anadwu de suom eno ane se okoso within 5 minutes no mo ha se de ba nkofo a wo monya sa ho mfaso no wo mo aba abontene ama pia beka endi a wo monya ye free drones ba ko de ba wo beka ye ba ye no ibisi ye de kutwa ma photo because no say drones de twa photo no bia
so women organizer men
whole woman organizer
also drone be so mo mayen hwe ye ka se nyina na mo yi drones na e deliver and drone bi na emayen
nti wo hwe de amanfo a e cover areas no a obehunu ade pa yewura baomia meka drones no asem kakra adabi sabe na mo director general of Ghana Health Service me wo ho anopa bi be na ye wukuada ena me hu se menya call na ye vice president baomia no so doc or California, San Francisco or Silicon Valley na akohunu adibia fi se o se de bagana ye de ba ya pomodini mu na me wo ho na mse me wo ha ti o da be no metima hu na mse o mba so mba echina kra omra ti ho na young men two young men o buka chiro mse zipline for say o mba be duru ha na ye Wednesday ti by Friday morning no mo mba office ti Friday morning ti ho na omba ye no so we see convince Euraba omia just what technology as
yeah of course yeah
ti omba me nche no edi 5 minutes na mpaja me nsa and you call minister for health for the health keka amonsem within a matter of about a year of all the resistance and e bie the dikai ewo omenako
yeah
ye de NDC for any MPP for select committee for a call Rwanda no mo waye ba kope moja nkwa na omdifa ye kohweye yeti conference room hwa na omi na obi apaja ne sase o sade omuka na omonti ase ibisi ye fanko ambulance ye fanko yewe eti eho ye yes adwuma no wie ye call Mr President ho also G2 mo esinsa contract ko call ye no isi nyame nchade ye wo maako ensia
ye ma menom awoka wo mo je tu no isan so we chichichi no ye be fa no kra free baby awo no e de na ba district hospital no na moja tu
no
be ne you know yetumi e de drone supply moja
na de wo kra de no se e fe ba kokra ne se e say no nam se drones ni ti no moja no blood bank for no national blood bank for no e chichim ti moja akoto ba ko no e betuma yi bibi e frɛ bibi plasma and red cells pack red cells ti ba ko no ti ndi mani pa bi no bi na ko hia plasma ko a ko hia pack cells ba first so ye fa ni nyina na de aba
yeah
cold chain system perfect womo system no ne yedi ye ya yedi etiminya na minus 80 degrees san ye nya yedi bi ba Ghana ha during the COVID period no mo ebi wo mo okoho na akohwe a is a complete modern store
and it's working. I mean, we share the number of deliveries. I hear over 1 million.
Yes,
over 1 million deliveries.
Yes.
Na I to
it is say
and see ana moja nko no supply.
Debi omo ye de no de ka say nye moja nko any vice president because doc mo fa ne be nka ho de moja vaccines de won kola ne COVID ba yi essential medicines obi hia aduro bi a ho hia pa na bi ni ho a quickly mu kwakọ.
Oh, so it's more it's like say even almost everything.
Everything.
Say emergency in corner the kofa ho.
Yes.
Say na see akwa deliver e friend say exams
paper me pa.
Yeah.
And abahwe a apart from we nyina no say ye de na any wo mu ye no. You can say any essential medicine and na obeka ya COVID by no. Na ye wo two laboratories ko lebu very Noguchi any cases ya okumase no. Na omo de fa samples
at the bar
Noguchi for samples at the KCC.
Oh, I see.
A lot of labs a free tool about 50.
Into reset of this basically means that
we are going back
to the days or echo be and we
because obi all can reset and say BBI impossible.
Yeah, of course.
Into reset and say a free possibility a impossibility.
And Dr. Mahmoud Bamia is preaching upgrade.
Upgrade
say yen fe bi kra mbeka ho na baby aka sisi emiemie mu no so emiemie ni etumi
kra na yentim ku yanim in the COVID fences zipline e say no say ye be ye the FS no yen kola no e bi ko Rwanda kusua de omusi o ma Rwanda fo na betu omu ye adwuma e say miracles onim say yen kola no nim dia omu wo technology mo no as we speak now the whole of the world no, one of the director of operations Ghana nearby.
Oh, I see.
There are two young men no more eshase or ha also new drones a betimi de bibia be deliver ewo aboboa no na asan akọ.
Yeah.
Yen kola mi no ho a omo engineers a omo ka ho a omo na ebo
develop. I see.
The efe wo mo kura biem ne say Ofa or Hamu Chichimu Aduesia, 60% of their workforce, very quality people. Maya.
Nice. Ghana had a
Ghana ha.
Okay, to come up
man does share mema.
I see.
Almost a chere secondary school ni JHS for honor. What artificial intelligence in a digital system means. Yes, it be a book.
And as I said, me school be woman, I come say, Yana. Drone center for the bus school
no muso ko akọhwe the how it operates.
Okay, doc enti
eno ba kono no enti research no kire say maka infrastructure ho asem research no kire say ambulance system na eguru e ba na ye 41 pe Ghana nyina yura ko fo sha ase ne ye metatra ho na so mo ko to bi ba ye no 30 no ko to ba ye na ye sprinter cargo buses hwini we who ambulance a to be siwa sana dividia be issue by the 307 new ambulances well fitted state of the art abekam as I say make us say in your district and I say biao in your 261 district but all the 275 constituencies will be our ambulance
in the big
e bi wo so aboso ko lebufo wo bi bi wo konfanoche ni ade ahun so eyusu ye
yeah e bi ni ye hwe nti ambulance bi ya na hu pictures ni videos ni ye hwe sisi
enti we na akire se yewura baomia e de sa upgrade na ba amade ye from 2017 e be pim na no ya hyem kena na ye move bibia forward.
Okay, now if I say doc, this issue of infrastructure me direct definite answer Nanado Danko Kufa, Dr. Mahmoud Bawumia Abany. Health infrastructure ben away. When this for say a one po. I'm saying back okay.
Now saying me am so or you one of the spokespeople or you more confirm or lebu or a professor or we money dey because I am more fast.
I mean who
and I'm in share or policy dialogue.
Yeah.
No say ye hospital back.
I almost back okay.
Question Busia no say so we kolebu or say I. I'm so this all quite and as an officer hospital and I say ya kokuru bi so akoma mfi ya kosi new hospital there be I'm catching say Mochri road or Mochri junction behind the NTC NTC for na then chipe kwa na down and the chibum you know there's a magnificent state of the art specialist hospital
your friend saying
your friend urology and nephrology
center. I've seen that hospital but I think we have those pictures.
Yes, urology and nephrology
neurology and nephrology
center.
Now what are they?
Almost be prostate any and I will be a renal problems. They say renal failure. Your dialysis center. I'm saying dialysis chairs and quite.
Oh, but Paul, we look at these pictures. These are very nice. Beautiful.
Best or
what can you say?
Operation be biao and the FHC say a ho and a bay center of excellence. So now me call into say na dialysis. Ye oba ye manifesto no more. Ye ya hwese dialysis nko a. Ya hwe chronic diseases. So oba hwe ye free bibi non-communicable disease and those lifestyle achievement. Ti ye hwe no from beginning what causes it? How do you say na obi hu ntem? Wa so ano ntem. Na dialysis no just a stopgap treatment.
Abewie no why
abewie na we eno kra say ema yare no nko. So yare no. The twatwo kra ye be a friend of transplant. Ti also say be call India ko ye
transplant South Africa.
Ye kasa say no. Ghana ha no ye ni mra e bought sa tissue and organ transplant. I say in fact omukura say be omkoye ekope emma na omoye IVF na mra bia ni ho a ebo ho ban. Inti ye the policy akọ Ministry of Health amo ahwehwe mu a be back cabinet say
after no ya chance ya ye
se bia ye ntimi ampass sa
it's kidney transplant ni sa no normally
kidney transplant because Ghana for Dr. 40 bit my give
it no center na be boa na sa na menye
center na be boa e be ye bi ho na center no aye center of excellence e betimi attracting confor from amanone they say dem confor ko India no your friend the medical tourist center
say obi te Nigeria bi obi to Benin Togo West African sub-region onim say we call Ghana neurology and nephrology center da
akoyemi
but it's a very beautiful edifice it's a big facility big facility
makorona need to say as a president kwa commission your commission we are near we so mo share dialysis machines no omo share we are be a very big dialysis center omo to my dialysis be twice a day just say
that was our facility doc and then what else
and look at and now let church room ye baye no ukaya unim Eurojet project
they are conforming here
Eurojet project in 9 hospitals
so the president conforming here 2000
president conform April me church room na make committee no am conform nochi April 2008 and minister for health Yuri Akoshiga onyan be biko and minister for defense Samere Yuri Kandapa the minister for defense kona dokonfo stand the presidency for president and almost in San Krata woman Eurojet indexer almost free Egypt to almost in San Krata no scan a free Barclays PLC and a back and a core cabinet and a cabinet they call parliament I think somewhere in is it September October and a cabinet approval loan say approval loan and say loan
yeah.
And Yamian fast be a Managana for a Trapama and DC for. Umbetra ho, Ubekaya, maybe Omukati saw the first one regional hospital.
Yeah.
Into for first 4 years in I want to be and she project nothing. Into a one regional hospital and Kumasi regional hospital was Sevilla. Baku Konongo, Udumasi, Baku Tepa, Baku Chufu Praso. baako so wɔ Nsoko baako wɔ Kwabenya nti 6 district hospitals and 2 regional hospitals and a military hospital. Over the whole of the 8 years
British was affair.
Okay. The whole of the 8 years NDC BD about so Mahama or a vice president or president for 4 years about 4 months no.
It is a 9 Eurojet project here on Penikufor shares here. A BNY and this for we not even what to my baby. What's the status of the and no Kasane. The first one, era president, the Kufuor Kopa Hontoma in 2018. Okpa Hontoma can say, "Sa project we a project I say Ghana ye constitutional rule ye juma." A fat president Mako and 4 president. President Kufuor, late President J.E. Mills, President Mahama, and no, and Yamen Chadie. Abawa on over Pahuntuma to Oyeno. Second one, Kwabenya, Ga East. Yes. Third one, ye Pahuntuma, Tepa, District Hospital, 60-bed hospital. Fourth one, Pahuntuma, Nsoko, District Hospital. Fifth one, Pahuntuma, Kifupraso Hospital. And a 6th way Pahuntuma, we are Pahuntuma, Mojuma, Konongo Masi. Into all these hospitals,
we. Intimi who said your copy is can buy. And I said your buyer one way who Sicano, what now was all fair wage our dears for Sidama Bushia.
To from the show.
Now, or to form the Asha, who would also a day a yen cacra, no jay. And I said your buyer now, one no copy is can buy, no Bushia for that. As if we are banner who say, "Osi and we mu ensia as we speak now." The 7th one, I say we are as make us say no. In fideli in egum ye the aka na ka light electricity ye connect. The aka ye kwan because kwan na ho na bridge bi ase ya make us say you my bridge na we o ye culvert. The oil contractor ka chem say bosumi aso. Am say be 2 weeks time obi wie kwan no. Kwa kopa hontoba. Aferi hospital eno na ache by afere kra mfidie ni ayi nyina egu hospital no mu a e say make us say omo yesi way system soldier for na radio nkwa ye mu adwuma na aka accommodation na omo wie eno metuma ya adwuma
zero kocha amampeni kofo Eurojet hospitals 9 no chance here
omo anye ba
8 years NDC fan ye ba
omo anye ba kokura nwi
but amampeni kofo asefo ono a nua bema na nadranko ekufo ado aba abewie
say obewie emu ni we emu nwotwe yentimi bia yentimi nwi ansa na yewura kufo afiri kwaso but minim say yewura ba omia ba
of course
ba to aso no wa complete salaga
okay and then which
to so bi mu yenye nkofo a ye ba bibi wo ho a yenye ba me kire de yeso ye hia ase ya hye hospital new one ase ye ni ayeko sika no ye ba ye ni ye hye ase ene ye eye Aduanansum 47 completed.
And you are saying that 47 what?
Completed facilities.
Let's put this on record, Doc. What say? There were 47 hospitals.
Yes.
Now do danko ekufu ado ankasa. And no kofeska. And no selected locations. And no koye hospitals. Mako 47.
Yes.
We.
Yes. Hospitals. 47. And isolation centers in our best
47
facilities. We will listen.
Okay, Mr. Shamo, let's put that. So let's send a work manifesto.
Yes.
Let's put that list up. The list of the 47 completed health facilities, hospitals, isolation centers,
and hospitals and clinics.
We should. I think we should project names. No, no be a document. Location, the name of the hospital, the location, and all of that.
Agenda 111. So,
of course.
And yes, I share 17 hospitals and can't get the 111.
It's 47 hospitals in your hospitals, and then out of that, outside that 47,
there are 17.
Yes, I was 17 hospitals.
And can't agenda 111.
And of course, and count.
And no matter the baby, including other projects, IPA, MSDI for no way. And a SIF for so ye be.
Yeah.
And no count. And a sour 21 treatment and holding centers.
About 17 hospitals here, and I check account. Because last week, I think we should show that video. The video of Dr. Mahmoud Bawumia commissioning the Achiase District Hospital.
Yes,
Achiase District Hospital.
47.
47 hospitals now. Dr. Mahmoud Bawumia area no.
Yes. Obibia.
Oh, and okay. It's I don't know. Can say yes. 47. We Achiase District Hospital. And this hospital is not part of Agenda 111. No. A part of 47 hospitals. Now the Danko Kufado. Okay.
Yes, I was 21 treatment centers. Who said got COVID by?
Educrum can we want and patrol with them in Toronto. Educrum Hospital can Achiase group. And I think we should show that.
So I'm a hospital.
It's all these pictures, the videos here showing hospitals are
40 beds.
Nana at the Danko Kufado. I see district hospitals are where
thank you.
I don't know. And Kanja
Any assignment 21 treatment centers, any isolation centers. Danko Akufo-Addo be shasia emu edumi ensa 13 wawie.
So 21 treatment centers no. Emu 13 wawie.
Ebi wo ba akukura was sibila.
I think we should at this point no the list you are seeing here, the list of the 21 treatment centers. And at 13 na yewie no so na
holding centers. And sana agenda 111 eba.
Okay.
Agenda 111 eye district hospitals first like 101. You say the miensa kora kan ye dey Karaga Menshia ene nkoransa kan ho. Tie 104 by the Freda agenda 111. 7 regional hospitals, all the 6 new regions no. Oti Savannah,
Bono East,
Ahafo,
Western
North, and Northeast. We nyina benya new hospital. And the Eura president the Akufo-Addo so also kan dia we yenti no. Or promises obey new hospital. Regional hospital Western region Watakurade. And also the Ahiase kura almost.
It is our agenda 111 hospital facilities, you know. What's the capacity?
A standard
district hospital.
Baby, a depend also can say this a best 60 beds. Be a hospital be a bill. And the urban areas of population in also 100 beds.
Okay.
I was a 60 bed hospital with my 100 beds.
Look, agenda 111 a mudu do send you.
Agenda 111 and also be bahadaku. Number for Nini natural.
But I got 3 months. Yeah, agenda 111 104 no. The presidency here woman status of each of them.
One. It's your the status. It say yeah kasa say agenda 111 the regional hospitals no. Baako and Ashasi. Inti nim contractor for be ho adwuma e free be EPC plus financing. It say our finance our value for money. Omo train say debt restructure no e didn't crata special.
District hospitals agenda 111.
District hospitals no. Emu 100 and you see 104 no e kan ho asem no. Emu 96 ye wa asase bibia ho ya hyase.
Okay.
It range from 5%. It be afi ne bi hyase a omo ye foundation ya de to e be do 92%.
92% no.
90 above, okay, make above 70%.
Yes.
Likely say, be about before the end of the year.
Okay, so by December, no?
By December. And no, by December, the near to say, bit me, Pessi, you are President Akufo-Addo. Or Kodaya or Junior Hoa or the buyer. At Obetimi, Edin, there, the phone in be a Bobby home. We are earmarking about 21 to finish.
By December, no? 21 of the agenda 111 bit me. Others at various stages.
Others at various stages. We do 60% near them. I mean, they continue.
Where they are different from
17
district
20 yeah.
17 na Edukrom Achiase mo eka. And I know so sounds here different from 47 completed hospitals and another Danko Akufo-Addo.
And different.
Okay.
And the woman imagine the one krabehwe a kama ne say ya Yura President Akufo-Addo ne Yura Bawumia a omu di animu anwene say bia yenye no one region and I say enkoye central region maybe can say na make kasa I say enkoye na Ashanti region and na Eastern region ne vote my all the 16 regions in the country.
By the time we are done with agenda 111 You were 261 districts.
Every district will have a state-of-the-art
district
hospital.
So that's the objective.
That's the objective. District hospitals in Ghana terms, you have 5-tier system. What is health system now? You have chips. May equity chips not to say be a electoral area. And a police station maybe. And you have the second level, no, a sub-district. You have health centers, maternity homes, maybe a polyclinic. And you have the third tier, a district hospital. And now be just a doctor to hold you, my operation theatre or you hear my baby. It will be area if free sub-district one, which is health centers, any polyclinics, and I say chip centers and honey, I did not call. In Kukuru be and Father Macoli, Emilia no bed syndrome. It will feel enough you call a friend of regional hospitals, the referral center and as a specialist
from the district hospitals.
From the district hospital, every region will have a regional hospital. As I know, company for them, Kolebuni, Confuanoche, 37, or the tertiary or teaching or.
So this whole arrangement, is to reduce the pressure on the regional and the tertiary hospital. Because we have Kolebo be in the area kasi abapa no.
Na fi no be the malaria abaho. Na ye sa no na me kai say nwumre bi adwundwune ho na Yewura president bu say na ma say psychiatric hospital he na wonam say pachoni nyina wo mpoa no. Osa ankafo pantan ena Accra Psychiatric Hospital 1914 yesi yen na yefe na Salam also when you say yenya psychiatric hospital yentimi ansi nyina o baabi a wonya ne covid period mo ade ne yenye bi wo middle belt yenye ne belt je certain belt o mu bi coastal belt fo no bi ti yen fan ye sa belt no yenye ba ko so wo middle belt and ba ko wo northern belt for the first time in the history of this country.
And we are sure
the war psychiatric hospital war, for example, Tamale will complete and commission this year.
So this is a psychiatric hospital in the northern belt.
Yes.
That was started by Ekufuado and completed by Ekufuado. So this is different from the 47 now.
Different. And it's
different from the 17.
Yes.
No?
They
are
war,
different from 21.
And now Udina Janawa was a psychiatric hospital on a Juso municipality. And also Gusua seems about 35 to 40%. Contractors now only very good. It will more fast.
Doc, do we have projects? Former President Mahama, and now if I say this, you buy is it the case?
Mebusa almost several times. Say omonchire baako. Maybe chere we be. You buy no. You be inherit hospitals na all ye. Obekaya, you will be a NMS project.
NMS, yes.
Ana ehoka $175 million. Eye dodowa. Omo wie kama eno do omo wie pa omo hontuma. Formana. Kumawu. Garo timpani.
Yeah.
Abetifi. Ena Kasarado ewo second day. Ena Takoradi European Hospital accommodation. Ba ko pe ena otimi omo oyewie
dodowa.
Ehyiase 2012.
Eno dodowa. To dodowa na omo NMS projects no omo
wie.
Omo jade aka ni nyina.
Omo wie dodowa no. De aka no Garo timpani omo huna sase na so ko gina
ko kan. Bisika na omo de koye research, political research.
Omo de bi koye research. Enya me na make on.
Oh, the
former deputy.
It's almost say sa NMS project now and then say. In fact, it's one of the reasons why Betifi project into be started. Ade ba punto omo to be an sharp Betifi project na say and say omo de sa scan bi. Ekoye omo research omo de
ko. And obeka say Ayishi Central Medical Stores Association.
Yes, I remember.
Almost half a scan be $6 million or so dollars. Eko kataso. Yankoye omko kataso.
Oh sa.
Eko dwi ho nyina, omo dwi ho nyina. Ede o de ko ba bia forensic ayi bia anya adwuma.
Yeah, because evidence
they diverted the money no. Contractor o ka so nkoye bi mo kwakoye. Enti omo be firi abamu akono na aka enso a omo nyenwe no. Ebi okro omo hu asase de adoso no. Next karaka 38.8 million. Ti e ba ye mekai, na be na organize service. Ye trans ya hwe mu a na contractor se obitim de awie kumawu formana ena Sata Kwadi accommodation. Nyame ncha de Yewura president Ekufuado. Enam se opesi ogya bibia to ho no. O mai ka se yenkoye ye de aye kumawu awie formana. Ye commission no say last
2 weeks
July. August, early August.
Early August. Yeah.
Ena Takrade de nso Minister for Health Commission no si aka abetifi
enti takwade komewu formula former president Mahama ni
the project
na ne kufa
do ba scan ba
oba 120 we wie project apa hontoma ena garu anything pani na ye one district it ko mbo one hospital you see garu enya hospital garu hospital no about 85% to 90% completed you be we apa hontoma timpani so new district no almost nya hospital to nya 2 instead of 1 kasarado won hu asase wo kwa obeka garu na nsen okoho ko ka se ka obesi hospital ha ena MPP for mpanimfo ho no wo kana himfie o MPP for mpanimfo no ho no fa iron ross no nyina na omakoto 19 yeah I remember that matter
nyame nchade asase ayesi garu de wo so na edru be 85 eko 90% no enya asase na omudema wo mo no yekonya asase foforo yesi hospital kama agenda wa ni nyina ese yesi second part ye no ebi enya asase kese no ye na borosa ntina ebi ye 5% to disa kra ne komase no omunya asase
tema west ye de no
tema west de nso beba tema west na asase
ne enya asase
se
afi de ebi ama
tespo but eno obi kura basa asase ye ne dia ye ka ho asa
esro mo man fan hospital
enti ye de be hospital enti wo hwe we nyina na ka bomu a na kire se abanwe yewura Kufuado eni na be de akire be wo mia omo dwene se apomudini o ma obi adesua na de apomudini pa ka no ho a na de aduane ka no ho a de bi mu
enti Kufuor project ye beto ye na do aye
waye
former president Mahama project obeto ye na do aye
waye
na ono ankasa ne hospitals awaye no 47 we wie 21 district hospital awasha ase na agenda 111 project no so ye no o de saka ni
na 17 projects ye to so no you say the aka yentimi nyenwe ya betifi.
Okay, Doc, the last aspect of the conversation before we move into the manifesto and all of that, you know, because now the infrastructure bit is what it is.
Yes.
And then, you know, propaganda, and then Kufuor don't share hospital back, on share hospital back. Yeah, Chilamo Hospital 47 our year. Near Chamo 17 district hospitals, I know you're different. What's the answer? I home. Near Chamo 21 treatment centers our year. Now, if you see agenda 1 when Ukrainian Basso. It is that on chair hospital back away no ada munjan tunche.
It be a quickly, but I mean hospitals are about 17 facilities are you ben heritage are you maka formana maka kumawu maka takura the staff accommodation be quite and quite shall see president for 4 times so omo ntimi anwi and be wie radiotherapy and nuclear medicine center wo Kolebu na de wo konfo anochi and so ye betoi and ye complete ye a shaman polyclinic 5 polyclinics and we have 15 beds a shaman a dental obojo polyclinic botiano polyclinic Oduman polyclinic any sigi ewo greater Accra ye betoi if I ben scan o honti any be sha say from 2017 ye wie ni na obekaya na what almost was 10 hospital bi a ewo central region on say you 10 or the Minukra constituency say womo present minority leader
to force
and so you betoi na wo mo ha say 26
it these are list of projects you betu ya
you be no pesca to wo wita voter region so menya Tolon Sola Bupe Bamboy you be sha say wi be ka ya Tolon de no
tie ba ya
vice president in the kopa ho
ya
wita de no tie ye ni nyina tie ye nya projects
and this project our boy a different from 17 now na danko Kufuor and so I
17 is
but more quickly
17 projects na danko Kufuor e beto ya owie ni nyina no eso wa ha
say a chiase die ka ho
yes
and edukum die so ka ho
17 projects a contombra
okay ebobo
bogoso elubo mpoho nsuayem wasadunkwaw swame hwede sabronum drobonso manson kwanta mmem nkwatia kwaw kwaben atiwa adukrum achiase jumapo pond kantamanso
so
17 nti we nyina awie ena ohem kra 19
okay nti the other two
the other one no in fact we kra 26 no hwe yeah I'm say you can 17 kra we the omo win 47 na make on Yeah, we are 47 am baso.
Okay.
So we are 47.
Yeah.
It is Jumapo Pon Kantamanso. So we are Sanyo so modernization of the Takwashi Memorial Hospital. Modernization of Chibi.
Okay, into we money rehab anyway.
Rehab.
It is 17 new ones in there and no epim Jumapo.
Epim Jumapo.
So those are the 17.
No, epim 18 epim
Pon Kantamanso.
So we are Sanyo 19.
So those are the 18
and the hospitals are and
that's where my interest is.
Yes,
that's where my interest
and then there are clinics. What can I say? Borakatanga phase 2, so phase 3
and I do those saying because they be into me bobonina
and a urology and nephrology center and a UGMC phase 2 and
UGMC there say atame was na kufa na ye
yeah the American say omo ya omo see a for example Accra, Greater Accra Regional Hospital.
Yeah.
Rage is not finished. Rage is phase 1, phase 2. What's the agenda? Diana Musa said, hospital be no omuwe, yes, be a bank hospital bank for this year.
But say Rage put there and former President Mills.
Yes.
And UGMC so. But there's something going around that I think so it's a matter of fact, maybe. I think for the record, no, it looks as if former President Mahama and Kasa only project be on one Kasa. A chassis or you
be a dodoa
any day him
say NMS and the episode of buying over here say
intended him
a dodo one ko
asa oh sir
yes
oh but no more ya no say na o hospital
say one more president the late President Mills office on we ni na but UGMC President Mills in the
UGMC we didn't put so much here and they say President Mills in that danko UGMC yeah
President Mills and
yeah
bank hospital any maritime hospital President Mills time has
into former President Mahama there no so many
dodowa
there no is the one that he started
or started
and completed Ekufa da 47
yes
former President Mahama year 1
yes
doc I think say infrastructure conversation yeah the base here now you move on quickly to human resource before then we come and wrap up with the manifesto
human resource obekaya ye buy na there was embargo on one time call COVID ni ade na there were 4 from 2012 year
2013 14 15 16
yes when finance bia ye buy dey be hyase e fa omu nyina during COVID period na ewiase ehu se hiankofo ho na ye fa nipa dodo pa about 56,000 health
at a time 56,000
in a year
in 1 year
into
that means now that's what you say MPP ye train ye beto about 3 months and ye fanipa
oh na COVID period as be workers examine 2020 but the problem is that 2017 next for the pharmacists for muja mo no na ye to aba
ye form
2018 na ye to aba 2019 na ye to aba 2020 na be ye to aba 2021 na ye to aba 2022 na ye to aba 2023 na ye to aba
each of these years in ye fanipa
ya fanipa nkoa e de abeka health workforce no 100 ye de 15,000 we kan ho a 185,000
yankwa
period
it's 4 years obedi o
mampeni show statistics
4 years obedi o mampeni uja ne next for nyina 13 14 15 16
uja wo nyina go afa akokora
ine eba fo nyina
na se no okase uja yitua next allowance tua se be ya obetimi de bi infrastructure mu
asa infrastructure nso no
uja tua no obebi infrastructure ni mu no and no loan don't the one with him the car
na making and say no do
120 beds
until 4 batches are 1 4 million this hospital back
we see back also what they
because that's what he said
also what they you know ebe fa if one call for now obenya adwuma ma wo mu enti u say reset ni nyina che say wo back
yeah
enti yana call for kasi
enti no na kufu ado ne ba o 8 years no ma fa health professionals go over 180,000
we make a new one about health force
over 180,000
wow
within just the 8-year period
kakra is for the first time it me for pharmacists for any health administrators for 1 year no sa 2020 no bomo in bulk na so mba me say o mu dem asese organ health service it me for administrators over 200 o mu hu bi da
hu bi sada
o kro mu no so nurses in doors and doctors in
no conditions necessary has it in the past
conditions
8 years no
8 years no at least on say na car waiver system me so waka ho asem
yeah
on obetwa car waiver
bebo former President Mahama.
No twa ka we.
No twa nurse for ne.
Any doctor for
cars no
because I agree with him. Maybe another it wasn't well planned in Manema. There was a lot of abuse.
Into no between. Former President Mahama the twa.
No twa.
Look, former President Mahama the twa.
Import with a
he say
for any teachers.
Yeah. Teachers here so far President Mahama the twa.
Yes. And no yeah adibia obetimi won say wo hwe brain drainer you will push and pull factors. The name my man call for call abrochire no bia nka onya car ketom ko betumi da ye Uber na wo de atete ho ne ade na bi ne ho ba wo betumi akra car ba na wo yusu ye cars wo Ghana ha eno isa system ye no a betumi de aye ne ama cars no bo kra ye funu matoka kwa new car
because taxes there that's no betumi
yes it is one na wo mato new car say any second hand tier rubber obi so cent
yeah
iti we ade a wo twa mu ade e be hu se wonti mi na non kan say obesa state nurses and teachers teacher training allowance and em so offer
ko no crime so nansi an wako ho akoka bibisa
wase oba obefa wo mu na mama wo mu yi
look yenko 2020 manifesto no so based on all these things I waka ho se mu nyina yi Dr. Mahmoud Bawumia say foundation na waka ya building health infrastructure and then normal ya building foundation ya building nyina no the news wade who going into the future no e ba beka and so one nti you better take such a quick break.
Access to quality healthcare is a fundamental right, and under the NPP, we've made significant strides to ensure this for every Ghanaian. Through key initiatives like Agenda 111, which has built new medical facilities across the nation, and the establishment of the National Vaccine Institute, with greatly enhanced healthcare infrastructure and capabilities. We've empowered healthcare workers with better training and tools, leading to a noticeable decrease in mortality rates and improved immunization coverage. But our work isn't done. We're committed to further advancing our healthcare systems to ensure even broader access and higher quality of care. Join us as we continue to invest in a healthier future for all. Vote for Bawumia. Bawumia means business.
It was a form of cover. Now, and then you show accommodation is a media me dream kakra. Now, me just say movie brains or what? Yes, who dream? What's in your mapa? Dr. Mahmoud Bawumia and another Kufa Daba we are ya. Especially when it comes to health. And who say why ye care? Now, a come here say, the ADC for Kenya and say, and found the wire baby kakana kana. Ye gidi say see a meme immunity and to a bentiam. Omodiano. Because Sambitian Yama, you made Doctor is yasare, any year come once a month, ye tribune for ni ye videos each year. Clearly, between Dr. Mahmoud Bawumia and Mama, former president. Ninjini say kese to me former president Kwabedi and him saying something about your day. Emmanuel say, Yan to a bentia, or more modern she do ya bay. Nian to my wo, or Mampeni, I would do a Mampeni 4 years, went to me on finance in Niba Kumpodium. Or Mampeni, I bed you a Mampeni 4 years. Hospitals, a friend hospital bar, pet, and I would to me shall see a SUV. Yan to Mount. Nian to tear the Onoba wire hospitals, near health facilities 47. Yan to Mount. Nian to tear the Onoba wire district hospitals, Makumako 17. Yan to Mount. Nian to tear the Onomeno Casey, what shall see or make sure say this should be our Ghana Benya hospitals, sir. Over 104 hospitals and Kwan for district year. What shall see oh yeah. And tia see enim. Now, to send you see no next chapter no. Yet the answer say, maybe no creditor, maybe a senator no, Nediato. Near church, Ghana New York, Kwakotwabano. The NTS one of Tunaba, Emma Dr. Mahmoud Bawumia. Former President Mahama say, Yentumana on research Ghana. Research and they say, Niama ya no, Nadrimono, Papa be enim, into young pepper, Yanko Shasia for. And Shasia for then they say, and they say, health insurance and net auto doctor in no way we know, the best sign the cheap. And they say, hospitals are yes, yeah, no, or better the boss enough 4 years, no, what's your research and Yako Shasia that big. And that is why it's important to better upgrade. Upgrade the and say, the improvement ba. Now the aka yeah, it's a me monosono. I share the way me. And then you may, Dr. Anthony Insia Asare, Presidential Advisor on Health. Our Sansuye, member of the MPP 2024 Manifesto Committee on Health. And ye di and common. A church in Yaman Bibri, the cancer bebree ene no bebi edri no ye be hwe Dr. Mahmoud Bawumia manifesto for health going into the future. Be what the tougher highlights no in the beka wasem na details ni de ye benya e with the full manifesto nim. Doc, e ma kwa bebiom.
Yeah, ja.
Number 1. In fact, the headline for Dr. Mahmoud Bawumia health manifesto ni provide better health care for all. Provide better health care for all. No a poor teacher any day.
A poor teacher is say in idea sako shekratasi or World Health Organization say in fear impimi no eduasa 2030 also am krabia wate o man bia mu Ghana ka ho also timinya ayaresa papa a ebe no abra onkoton no ho neema ehihia sana onya ayaresa no tie na efe no universal health coverage better health for all inti eye bibia na eno wose ye de so e po teche ni say COVID-19 ne bae no e ma country bia hu say wose ehwe ni ye because pandemics and say sa ayichem sem no e ba e mokokoko e duba hwe manifesto no a sa pepepepe ne ye fae se be ya ade a yetimi aye etima COVID-19 no kontem ade ewiase memu nyina na ye ka inkruma akoma mensa yetimi manage COVID-19 ye no sa nye ne ye ka the whole world and economy they can say one of the third countries manage COVID-19 ye no enisi etotonase na yehemu kena na yepejem na se bia bibi nyame yebom paise nyame mfa saaba ebeba biemu a ye obabi a ebetimi ede yankofo afa yanhwere
epezi no swade hu no that's a bigger picture nti mo say Dr. Mahmoud Bawumia eni swade hu e dika say complete all agenda 111 hospital. This ensures every district gets a district hospital.
Yes. Ti empese obi tu ni nan e free manfe. Hokra dey district Akuapem North. Now kaso okopa yaresa e wo
New Jabin
South. Empese bi
sa. Say if you Okre district, in fact Okre district, Akuapem North municipality, Akuapem South na Ebri, Adenta any Madina. So 5 districts in your district hospital here back up Tete Kwashi Memorial Hospital.
Those will be a one will be a
but the name no Edukrom Hospital are ready for
okay
people. Akuapem South for the are ready.
Thank you.
Madina ne Adenta the so our own.
So you go so. Yeah. Tisa ni dikai. Ye toso mienu so ne say also yetimi in such a way say wo ko hospital no a unko hinhia mu nkope unisika je say obewu eno so ka ho bi eno na ukaya 2003 yura president Kofo eso de ye kan manifesto say se nyame ya dom ne ba ba mu 2001 January ba ba mu no edwundwene ho aso 2003 ene ye share samran for national health insurance
ene me ba mama say ndc for the buy
na no obi ka chem say ndc for the buy na JJ Rollins.
And for the attendant to her next chapter here
JJ Rollins had the buy, but they may you know say they are no person watch it. Africa almost say we cry the buy 2012 and over here.
Free SHS course on the buy in Ziana.
Tibia cry na wa kwa waka so no ya.
NTBia.
It is sanity and won koton ho ne ma na dokọ ho yare. Wo yare na pese de ko ba bi so a ye fa wa na ye de wo ko ambulance wo.
Second one recruit more doctors.
Yes.
Nurses and other health professionals with improved conditions of service.
Yes. They say we are sememu nyina de asie ni say onim say COVID buy no ama pi o ma no ye nurse for na nyina bi kura jaye o mo ko nursing training school ene ne ma ne but ye nyame ncha de because of free SHS. They say nkola no awon be so mo ko nursing e ko medicine unya gege wan hwekra unya 6 years kura unya medical school ko enti pese e training nipa no pi na yetimi so fa wo mu nyame ncha de because of agenda 111 yesie ni hospital yesie nyina no ke se kwan bebie na wafa obi awie no also utimi mani pakro no tena ho na utraining no na wo mane akane a wo de be ye adwuma to unya ni hospital a ukoye adwuma apart from salary a wo sabeka no be bia wo ye adwuma so hia pa se me ye surgeon o wura theater na wo pa fidie bia ye adwuma na unya bi ya che bi bia wo be nu nkura se wo ye adwuma no ti be bia wo ye adwuma de kama ye toso mi no no se pakro no so ne daachi odwene ne daachi ene man kofo kwa abrochire no ti wafa no wie no wonya baabi a obeye adwuma no na onya baabi so a odi ntiri beto ti wobehwe a ewo manifesto no even under infrastructure say
ya housing
enye aban ne besisi daa no ankorankorafo bi eya abaso mo sisi daa no epese ye di bi ka hospitals ni nyina nti wo fa ne bag a obekọ 3 bedrooms air condition wo ho empa ne bi asi wo no akotena ho mo wa say obedi be mfie miensa na waka kuru
o ka say sa conditions of service bi na health professionals doctors for bi sa and more man penny catch up so on you ready so no be negotiate.
Thank you.
Now no he has seen so much strike. Now strike NFA and see why you join and go for buy you. To the extent say in fact I think we have to play that video. Doc Mayebe Sema Niambosa video no. Young health professionals are omugu control accountant general egu Ministry of Health. Car park. Yes, let's say yen form odwuma mu ebi mu so say yen to market you money ade. I think we need to watch that video shortly and come back. Timo be mbosa video no quickly ni enkombra.
The doctors insist that their leaders are in there to listen to what government has to say to them, and they are not there to take any decision on their behalf. Their leaders are there to report back to them whatever they hear from government, and they will finally take a decision on their next line of action. But they still maintain that until their monies hit their accounts, they are not leaving the premises of the Controller and Accountants General Department.
We are expecting that we are paid as soon as possible. We are only here because we want our salaries that we have worked hard for and we have earned. So that is the bottom line. That is our hope that we are paid.
But what happens, I mean, if you don't get paid today? Because, I mean, we heard the finance minister over the weekend say that your money will be ready in 2 weeks.
Oh, yes, but we are very optimistic. Okay, it can be done. We believe that it can be done, and it can be done today and not in 2 weeks' time.
I expect them to give us our full money. That's all. That's why we are here today. So they should tell us something that will make us live. And this is only the money. Either the money will hit our accounts, or they should give us the checks, like what they did for Konfanochi Teaching Hospital a few months back. Because we were as a group, and they decided to divide us by giving them checks. And the hospital was later reimbursed. So that's what we also want. We want the money. If we don't have the money, we are not leaving.
I also want to admit that it's taken us too long to have addressed the concerns of the junior doctors.
This was the situation under the former president when he was president. Stranded young health professionals simply asking to be employed, others also simply asking for their conditions of service to be improved. This is him. Now, when the doctor said, say, or improve your more conditions of service, Mr. Mo, and also moment in Tiedia or Kokaye. Sasa we Okaye and Podon Jinagano. Ojina far away, Rwanda was a Botswana. No catch them say, the Kurumukra strike, and we all know Obedio Mampeni. When who strikes must strike and Yenashe. Why is so dreadful? The famous Odrenfunu, the famous Minstro Sekai quote, no. I mean,
trade unions and everybody sees that government is in a vulnerable place. And so that's when demonstrations and things, agitations for increased pay and all that begin to happen. And because of the sensitivity of the period and probably the fear of losing elections, government, normally would give in to some of these pressures. And before you see, the budget is out of sync. And then when elections are over and government is installed, you have to start the belt tightening all over again. The advantage going for me is I've seen more demonstrations and strikes in my first 2 years. I don't think it can get worse in the second 2 years. And it is said that when you kill the goat and you frighten it with a knife, it doesn't fear the knife because it's dead already. So I have the dead goat syndrome going forward.
This is the situation the former president is asking us to reset to. What's he reset it? You reset it or minor health care no into the situation young people picketing, placards, Ejina, Ministry of Health, Ministry of Finance, Control and Accountant General, Dr. Foss say my conditions of service in kakra or say or no and yet must strike and mock candidate no yet ready so new be ebe negotiating and then waba or say yen to abamano na on reset Ghana. you are resetting this country into this situation. And that is why we keep saying, say, what we need is not a reset, but an upgrade. So that the aka yen to me you bet me abwa to but the year to me we don't have to reset to destroy it. We have to protect it once we improve upon it. Doc,
until the cano say we fan for no so no. When say we Ghana ha no a buying fa workers na adwuma wa pomodin so no. 99% of workers in are buying na fa wo. But akwa hospitals no. E pese ye ma wo so etimi ba no etimi fa ni pakora na ye de ma wo mu.
Okay.
O ma ye ready so betu ya omuka.
Okay.
E say nya nko fo pi o condition nyina be the same. Ye to so biem say oba fa ni pakora na abasan tuya neka. Ye to so biem say ni pakora na duru say ni promotion we promote no. E na sebe o ma ba ko nkurase no a hoye hard to reach areas in yama man so no. Ye will be a friend no rural allowance conditions and that table so that and no you about o me say oba obehwe no dia ye
the housing and accommodation
and a car waiver allowance
omko rural areas
and a waiver na and so this for the tray mo no so no ye hye ye ya shase ye kura di e de beba ama nurse for any pharmacist for no bia nya bi sebe ye obenya ne car obetwi and na ohwe credit system na eba no so a credit system na kwa obetwa ko ewura car manufacturer yi wo bia ya te duties no so ama wo na wo so akwa jiwo ka opeso okusua ade so a no ko ye postgraduate a he say doctor for there no scholar secretariat for the tuition fee
specialist training no
ye de be omo nyina so ba we ka ho bi nya sa no condition
but I read here say specialist training no e be free.
Yes.
It's all health professionals.
Doctor for the free. Into all the other health workers.
To Dr. Baumia, all the others.
No Sunday.
A reset would remove some free specialist training for doctors, you know. But an upgrade, a big keepy specialist training for doctors free, you know. Necessarily all health professionals.
Even for allied health laboratory for also Yama almost college.
It's we are very simple docs. You can say a table. NDC waha, MPP waha. NDC a reset, MPP upgrade. NDC research now na just say and doctors say call omo specialist training free no NDC research no be mo matua
yes
MPP research no ebema doctors free no atwa so no the other health professionals are there abeka ho NDC research no say doctor for waiver no yes and so yin free ho MPP research no say doctor for all other health professionals ebenya waivers for omo kasa omo beto NDC research no just say so one for yasem MPP upgrade ni say more housing allowance and more accommodation allowance. So I think the choices are clear, yes. and the way forward is quite clear for
very clear.
Doc, third one, I say bring health care services to your doorsteps by A, completing the digitization of public health care institutions under the e-health project. B, scaling up telehealth services. C, establishing 2 additional sites in addition to the existing 6 at Fonsi and Kintampo to enhance drone delivery services and to ensure total nationwide coverage. And at D, ensuring the interoperability of the National Electronic Pharmacy Platform with public and private healthcare facilities. Sanyama and Nai and
say Omo say ebeye ama on say tini ye agenda 111 no. Tina ye chip centers, ye health centers, ye de abefo enema beka ho telemedicine. Ake say bi wo kra ni say okọ hospital. Ebi a wo ho wa fa duro wani so bru wan so fa wo phone ukọ app bi so a go for obetuma fa phone call center nyina bebem e be san ye bibi e frɛ no e for e say Ghana Health for call network of practice it is say health center wo e bi amanfe ene de wo adukrum wo mu nyina ye network tina eno ne hospitals here 24 hour service already by e be shebo kina se be ha say be midwife no and off but there's a midwife next door ya platform ake se obi kura anyem no midwife ho a in bi ehia se de no call hospital ti midwife no e be hwe na wo de records no e wo mu nyina platform so na bia doctor na wo hwe wo satisha ngana ko is no e wo tete kwashi hu pe o so mon refer no mrante because obi hia cesarean section ye ko ye bi 2018 e wo Northern region at maternal mortality so to almost about more than 70%.
I see.
Iti abefo nema de all the shebi bi mun telemedicine nema no. yɛayɛ network of practice yɛayɛ agenda 111 ɛne hɔ ne the first referral center yɛwɔ regional hospitals ɛne the second referral center waiting de obi akɔ hɔ yɛnya sɛ ɔfa no huu de ne firi otia bɛsene de bankran because dambai is regional hospital hɔ waiting na kɔ na we use a telemedicine and other things in na no ahwɛ hospital this o pay free in fee health insurance yɛ adwuma health insurance so ebi duru hɔ ɛno nyinaa ka ho
and the interoperability of the national electronic pharmacy platform no
yes nti okɔ pharmacy a ɛno asɛ okɔ platform no so a ebi tuma kyerɛ sɛ kɔ so ɔmo sɛ o ɛduru na o hwehwɛ no
menya bi wɔ ha
wobɛnya bi wɔ kofi pharmacy nti nya sɛ okɔ nante kɔ ns chemist na yi abi no
offer incentive for healthcare workers to buy one vehicle each with engine capacity of up to 1,000. They say no, you can't want some
incentives.
Some incentives. They say health professionals. And this time it's all health professionals.
All health professionals. Not
only doctors. All health professionals. And a Dr. Mahmoud Bawumia at the EBA. And then the final one here, ensure compliance with existing deprived area incentive package for health workers.
Thank you.
Also,
I can say, rural areas, you know. USAID for IS steady be a you categorize the country and higher less rural where higher severely higher the most rural area obi kono o feeling cry no ko transfer kura na se wo ye adwuma ehia se nyame ani o se man allowance bi ka ho o ko hwe obo hu ti anya se bi a wo ba bi a obi a gi salary pe se ba bi o ye adwuma no nko na wo ho a wo bre no hu ko no ho a eno ene allowance adi awon krata so ache nti raba o miaso oba obetra se o de aye adwuma ama nkofo
Dr. Anthony Isia Asare ebedo wase wa cheche nsem no yie pa na megidi se obi a otifi a otie wa ohwew ohese na woti ato obo asa cheche nsem de ebefa aye se na oman no ayaresa nsem sitie de ya ba bedu enne ene eniswade hu a Dr. Mahmoud Bawumia wona I am very sure say the decision between the reset of our health system and the upgrade of our health system is a very easy one. And like we always say on the next chapter show, no, yedi necessary assemblity no, any baby da no, yedi beto ho. Na the reason to vote for Dr. Mahmoud Bawumia. Na yami yadomo a ya woda eda yenim yi. Ye besan so ehia na yasen for another aspect of the MPP manifesto na yaka ho asem. But no sign off na meye no mesremo video na me di kaka se yembo no. Me the side video no be sign off na yapon. Ye be bo Dr. Mahmoud Bawumia ansem okaye embra one CEO se wo Ghana ha share the CEO summit nsem okaye no. Ye be bo sa video no ye bo wia na eche se makramo a enisa nyame yadomo a ya woda ye be san so hia.
But that collapsed economy is performing better than your economy that you left us. We have created more jobs